If you pay attention to social media, it often seems like our country has become divided over what it means to live with COVID-19. For some people, it means getting on with life just like before the pandemic. Many of those people feel that public health officials have been overstating the risk of the virus to people who are not medically vulnerable to it. But others feel that public health officials are understating the risks of COVID-19, such as long COVID. There's also the worry about the risks to vulnerable people and to the healthcare system. Well, just about the only thing these camps have in common is a distrust of our leaders and public health officials. So with new variants making their way through Canada, we invited our medical officer of health, Dr. Janet DeMille, to join us to talk about that divide and discuss the latest news with us. Good morning, Dr. DeMille.
Good morning.
So before we get to the most recent developments, perhaps we can talk about this fundamental disagreement over what it means to live with COVID. A lot of scientific papers being shared on social media in defense of different positions. Can you talk to us about the science that you're relying on to conclude that operating without mask mandates, at least at this point, or capacity limits in buildings is the right thing to do right now?
That is such a good and thought-provoking question, really, and it's something that I have, just based on your introduction, these are things that I'm always sort of following and listening to, and really, there is the science and the evidence and what we know. And then there is sort of the what are we willing to accept? And people have a different level of that risk tolerance about what happens to them or their families or communities, and that often plays into it. And it's really trying to find the right balance. And absolutely, there are experts who take a very strong approach, and there are others and who prefer a less strong and individual responsibilities and such. And there's really, we all have the same enemy, so to speak, which is this pandemic, and the real challenges of it and how it's changing and the different variants and subvariants that we're seeing and the different implications. And the other challenge is we often have to take actions, whether it's recommending another booster dose or whether it's masking or other types of measures. We have to do it before we often have a lot of information about a particular variant, because if you leave it too late, you end up experiencing those consequences, as a population or as communities, and that can be challenging. So making sort of decisions that, where the evidence is sort of there, but maybe still emerging on something. So it is really tricky, and there's a lot of conversations that happen, even here locally, even sort of regionally or, provincially, to make these decisions.
Mm-hmm. And we're hearing in the news this morning, some calls around the province to reintroduce mask mandates with the new variants coming in. Is there a metric or set of metrics that you're using to judge if and when that might be appropriate here?
So the direction right now is that the province, that those decisions are to be made provincially, either through the Office of the Chief Medical Officer of Health or, with the cabinet deciding. And, we've seen that who makes the decisions has changed throughout the course of the pandemic. And some of the legislative options that maybe previously gave me opportunity to do things have been removed. So this is a sort of a constant sort of dialogue. And the way, I have opportunity to provide input into what I see happening here, for example, and providing that context, but also informing some of those discussions. And they can be very, challenging around that. So, and is there a particular metrics? We watch a bunch of different metrics. None of them are perfect, but try to triangulate between them to tell the story of what's happening in this area. And that can be tricky because of data and sometimes, the data quality, limitations in the data, but also that we often it's a bit delayed. So I know what was happening 2 weeks ago and not now. And then I think, again, though, when you look at mandates, there's good things about mandates in that, everybody does it and there's a consistent level playing field, right? If it's in masking in indoor public spaces or masking in a hospital setting, level playing field, consistency across the province. But it does requiring people to wear masks who may be, it may not be something that they want to do. So you're making people do something, and it benefits some people much more than others. And so, but you make everybody kind of do it with mandates. So to be honest, I don't see that necessarily coming our way in terms of those mandates. There will be recommendations. I think when we might see a stronger masking mandate could be if there was a really sort of new variant or something kind of out of the blue. The way Omicron got us last November, right? All of a sudden it's coming and we don't have all of the information. And if something like that were to come out, I think maybe some tougher decisions would have to be made.
Now, people have expressed concerns that vulnerable people who have no choice but to ride transit or visit drugstores or grocery stores are now at increased risk because of the end of masking in those contexts. Why don't we have measures to protect people, I guess, who are genuinely vulnerable to COVID?
So, we do have a lot of measures that are in place. And it's sort of those layers of protection. And, one example that, I'm thinking of is we're doing a lot of work with various congregate living settings around infection prevention and control measures, the messaging, stay home if you're sick so that it's not spreading. Certainly, I still encourage people to wear masks when they're in indoor public spaces. I'm reviewing stuff around ventilation and indoor ventilation, just because that can really help without actually expecting people to do anything like a mask. If the ventilation is good, that will help. So there are all of those measures in place. And even what you see in places or people that they're more vulnerable, there are those restrictions are still imposed sometimes on people and who may not want to, those to be in place. So I think really it's finding that right balance and being able to adjust the measures that we might have, the things that we're doing based on the context that's happening, and being able to kind of, increase the measures when there's a more significant threat coming versus being able to drop them or reduce them when things are better.
Now, there are two new variants of COVID-19. We've been hearing about this BA4 and 5. Are we seeing those in Thunder Bay yet?
So we saw BA5. So this is some of the data that we get, and it tells us what happened 3 weeks ago. But I do know that some of the samples that we have that go for whole genome sequencing, and that's the fancy test that's needed to determine what variant or sublineage it is. And in the week of June 5th to 11th, 2 out of 34 samples that were whole sequenced that way were BA5. I'm not aware of BA4, but certainly we did see BA5, and then the next set of data will be out very shortly. So I think what I'm seeing in our overall numbers and looking at what's happening sort of across the province and a number of the indicators that I have, I think we have that BA5 here. I'm expecting that we are going to be more in this wave. We are, though, a bit behind the province, as we have been in the past, maybe by about 2 weeks. So I see in our numbers perhaps starting to go up again. We had dropped very nicely by the end of June. I'm starting to see perhaps an increase in that, and likely it's going to be driven by BA5.
And BA5, do we know anything about its transmissibility or symptoms?
So from transmissibility, it does seem to be more transmissible than the previous two variants that we've experienced waves in. So BA1, BA2 for Omicron, it does seem to be even more transmissible. When we think of symptoms, as far as I've seen, it's very similar symptoms. So the usual, fever, chills, potentially cough, sore throat kind of thing, and fatigue, and muscle aches and pains, and again, a variation of the symptoms that some people will experience. In severity, I don't see evidence that it is actually more severe than BA1 or BA2. So, there are still going to be people that will be hospitalized. So I do expect with a wave that the hospitalization numbers would go up. Still some people that will likely require ICU, but it does not seem to be worse than BA1 or 2, at least what we know right now. I think one of the challenges with BA5 is it's showing more immune evasiveness. So it is less, somebody who has had either vaccine, including the booster, or the actual infection with BA1 or BA2, there is less protection with that pre-existing sort of immunity. I mean, it's never perfect, but it even seems less. So we did see people with BA1 perhaps less likely to get BA2 if they had that infection, and we may see that that even shows up more that somebody who's had BA2 or BA1 is still susceptible for getting BA5, and with its higher transmissibility, that does pose a challenge.
Thank you so much once again for joining us. I suspect we will be talking again. I appreciate your time.
Yeah, if I can just say, I mean, we don't really know how big the wave is going to be here, and just encourage people to do those layers of protection that we've always talked about. And we're now experiencing summer, and I do encourage people to get outdoors because we don't always have that opportunity in the middle of January, but it's certainly a safer place to be inside. And, I think we still have to take care of ourselves and do the things that we enjoy and do that safely.
Thanks so much.
Thank you.
Bye-bye. Dr. Janet DeMille, Medical Officer of Health for the Thunder Bay District. 7 minutes now before 8 o'clock.